Hi, I'm Elie Khoury. I'm an orthopaedic surgeon. I've been practicing for 30 years and I have a subspecialty in hip replacement and knee replacement surgery. Today, we're going to talk about approaches to hip replacement because my patients ask me a lot about whether I do an anterior approach or whether I do a posterior approach. I'll put it out there straight away, FYI, I do a posterior approach. And a lot of patients think that anterior approach is better. It may be in some respects, it may not be, but according to the Orthopaedic Society, which is the peak body of joint replacement in Australia, however a surgeon does a hip replacement is excellent. There is no one better approach than another. And that seems to hold up in the scientific literature. Patients want an anterior approach, I think, because it's been well advertised and it's been rebranded. It's not new, it's old, but everything old is new again, and we bring things back, and that's good. One of the good things about an anterior approach is that it has a shorter recovery time, 3 weeks compared to 6 weeks for a posterior approach. In the scheme of things, that's not terribly quick, but if you're looking for a magic bullet, that's as close as you can get, maybe. But it does have a higher complication rate, like increased risk of fractures or malpositioning of prostheses. Also, there's a higher rate of nerve palsies. And so you've got to balance the pros versus the cons. And the incision is smaller. You can have a bikini incision, so you can hide the incision. But in general, I don't think it has many advantages. There is another advantage in that it might have a lower dislocation rate, although that's not been borne out in the scientific literature. I perform a posterior approach because I've done it all my life. I've looked at all my outcomes and we have a low fracture rate, low dislocation rate, and I do all of my complex surgery through a posterior approach. So I think the main issue is find a surgeon you like and go with them because you're likely to get a good operation no matter how it's done. So enjoy that. And if you have any further questions, please don't hesitate to ask.